So let's move on to the question number 6 in this single best answer paper. A 66-year-old lady, she referred to the memory clinic. So she had a problem in the memory. Her age is 66 years old, by her GP with memory problems. Over the last year, she has started to notice that she become more forgetful. She has misplaced her glasses a few times and find it harder to remember dates of appointments. She had to put a reminder in her phone for the clinic appointment, but ended up not needing it. So she attributes a lot of her issues to a stroke she had last year, from which she has made an excellent recovery. She is back swimming daily. This is very important and relevant. So she is back swimming daily, and the other thing, she does the weekly crossword in the paper. She's doing this, which is good, and she's trouser for the local community center. So she is. This is her daily. This is example of activity of daily living, ADLs. This is example of ADLs, activity of daily living, and seems this memory problem seems to be they are not big enough, or they are not severe enough to affect her activity of daily living. This is very important and relevant. Her examination revealed bilateral tremor, so she has bilateral tremor, which she tells you she has had this tremor in the last 40 odd years. So this is long-standing tremor. It is unlikely that this tremor is connected or related to her memory changes or her cognitive changes. So her MMSE, which is mini mental state exam, is 23 out of 30. 23 out of 30. This indicates a mild degree of cognitive dysfunction. Mild degree of cognitive dysfunction. This mild degree, it could be a mild degree of dementia, and or it's nowadays it's called neurocognitive disorder, or it could be what is called mild cognitive impairment, MCI, mild cognitive impairment. So if this is dementia, or in other words, it's major dementia, usually it will affect activity of daily living. If it is what is called mild cognitive impairment, so it won't affect the activity of daily living to much extension. So this is very important to focus on the difference between the major neurocognitive disorder and the mild cognitive impairment. The major difference between them, it is the how much the cognitive disorder affecting the activity of daily living. If it is severely affected the activity of daily living and instrumental activity daily living, we have other things is called instrumental activity of daily living, IADL. If these things markedly affected, this is most likely major neurocognitive disorder. And the most common cause of major neurocognitive disorder, it is Alzheimer's disease or Alzheimer's dementia. The other common or more common neurocognitive disorder, it is mild. It's called mild cognitive impairment. And here in this question, we have mild cognitive impairment. The characteristic of mild cognitive impairment, it is intermediate stage between the normal aging process and the major neurocognitive disorder. And the characteristic for mild cognitive impairment, it is mild degree of the reduction of the or mild degree in the for example, in the mini-mental state exam, here 23 is very characteristic for a mild degree in the cognitive dysfunction. And the other things, the other things which is characteristic for mild cognitive impairment, it is activity of daily living. Usually, it is not mild. It's either it's not affected at all, or it is affected in a very minimal extent. So this lady here, she is back swimming daily, and she does the weekly crossword in the paper, and she is still attending the local community center. So all of these things give us clues and keys that activity of daily living is not highly affected. So this is the most likely answer here. It is the C, which is mild cognitive impairment. A tremor here, it is the patient has the tremor for last 40 years, so it is unlikely to be connected with this cognitive dysfunction. Let's move on to question number 7. What is the most common organism colonized in the lung of the 35-year-old patient with cystic fibrosis? So in cases of cystic fibrosis in the children less than 10 years old, the most common microorganism is Staphylococcus aureus. For more than 10 years old and adult age group, the most common microorganism is Pseudomonas aeruginosa. So in this question, the answer is Pseudomonas aeruginosa. If this question was in the pediatric field for children less than 10 years old, the answer will be, it's going to be Staphylococcus aureus. Let's move on to question number 8. 60-year-old construction worker present with shortness of breath. He has shortness of breath, unintentional weight loss, and right-sided chest discomfort. He was exposed to asbestos for approximately 10 years. All of the following are associated with asbestos exposure except asbestosis. This is typical complication of asbestos exposure. Asbestosis, one of the interstitial lung disease, interstitial lung disease, asbestosis. Bronchoectasis is not associated with asbestos exposure. Bronchoectasis is not. Usually the asbestos particle can go far down to the alveoli and to the pleural space, and usually it affecting the pleural space and causing chronic pleural effusion or chronic pleuritis and pleural plaques. So here we have mesothelioma, which is the most common type of tumor associated with asbestos exposure, and the risk of mesothelioma, which is mesothelioma, it's pleural tumor. It's increased dramatically on asbestos exposure, especially if the patient is smoker. Pleural effusion is one of the associated as well, and pleural plaques as well is one of the association. So here the answer, most likely it's bronchoectasis. So the next question, question number 9, 65-year-old male presents with shortness of breath. So here we have shortness of breath, left-sided chest discomfort. Chest X-ray demonstrate left pleural effusion. Pleural fluid sampling confirm exudate. So here we have exudate pleural effusion. Exudate means high protein content in this pleural fluid, and the cause of exudate, either it is infection, either it is inflammation, or it could be infection or inflammation, or it could be malignancy as the cause of this exudate pleural effusion. Infections, inflammation, and malignancy. And we have other causes of exudate pleural effusion, for example, thromboembolic disease like pulmonary embolism. The other causes, pulmonary embolism, it can cause both. It can cause exudate pleural effusion, and it can cause transudate pleural effusion. It can cause both the pulmonary and pulmonary embolism. So here, all of the following are causes of an exudate pleural effusion, except he's asking about exudate. Hypothyroidism. Hypothyroidism, this is wrong. Why? Because this is cause of transudate pleural effusion. The cause of transudate pleural effusion, it is the failures. I am I can remember them by failures. It is heart failure, it's heart failure, it is renal failure, it is liver failure, it is thyroid failure, so it's hypothyroidism, it's liver failure, liver cirrhosis, and it is renal failure, and it is chronic kidney disease or acute renal failure, and heart failure. And the only inflammation that can cause transudate pleural effusion is pericarditis. It is pericarditis. So here and we have other causes, which is the pulmonary embolism. Pulmonary embolism can cause both. So here, malignancy, definitely it can cause this. Pancreatitis, it can cause exudate pleural effusion. Pneumonia definitely can cause exudate pleural effusion. Pulmonary embolism can cause both. So the answer here, hypothyroidism. So the question number 10, 61-year-old gentleman diagnosed with rectal adenocarcinoma and proceeds directly to laparoscopic low anterior resection. So he had a low anterior resection, laparoscopic for rectal adenocarcinoma. The procedure was technically difficult, and the consultant makes the decision to convert to the open procedure. Due to smoking history of the patient and low position of the anastomosis, the consultant performed loop ileostomy. So he performed ileostomy to protect the anastomosis. Which of the following statement is true regarding the stoma? Here you have to know that he wants the correct statement with regard to stoma formation. Standard colostomy is spouted. This is wrong. Why? Because the stoma usually it's spouted if the output of the stoma can cause irritation to the surrounding tissue. The usually spouted stoma, it is either it is ileostomy. I'm sorry. Either it is ileostomy. Why? Because the ileostomy output usually can do irritation to the skin. So the ileostomy is standard. Ileostomy is spouted, and the other type of stoma usually it's spouted. It is urostomy. Because the urine it can cause irritation to the skin. So standard colostomy is spouted. This is wrong. Standard ileostomy is located in the left lower quadrant of the abdomen. This is wrong. Why? The standard ileostomy it's located in the right lower quadrant, not in the left. It is in the right lower quadrant, which is more close to ileocecal valve. Which is more close anatomically to the ileum. The stoma which is located in the left lower quadrant, it is the colostomy. It is the colostomy. So this statement is wrong as well. The C, standard ileostomy is spouted. This is the right statement, and this is the answer most likely. Parastomal hernia is an early complication. This is wrong. This is late complication of stoma formation. Smoking is protective against wound infection. This is wrong. Smoking is a risk factor for wound infection. It's not a protective. So here the most likely answer is C. And this is the last question in this part. I will continue the other question in the next video. I hope this discussion is helpful and useful for your preparation for your final exams. Again, I will upload all of these videos and the previous videos of the discussion of the short answer question, and I'm going to discuss the single best answer questions, and I'd like to do a brief review brief preparation for OSCE exams and a crash review for the most important topics. All of these will be available in the teachable.com, and I'll put the link for all of these courses in the description to this YouTube video. Thank you very much for joining us, and hope you the best for your exam.